Welcome to this video developed by the NIHR-funded GPNET-0 study team, investigating the implementation of decarbonisation actions in general practice to achieve a net zero NHS. This video aims to summarise 6 key findings as established in the study's second policy brief, developed in April 2025, aiming to share key evidence as it emerges. Climate change is a cause of worsening health for people in all parts of the world. Healthcare has a significant emissions footprint. In the UK, the NHS contributes around 4 to 5% of total carbon emissions. To combat this, the NHS has set a target to reach net zero by 2040, as outlined in the Delivering a Net Zero National Health Service report. Every part of the NHS is expected to be working towards this ambition. There is increasing awareness of the importance of general practice in this context. The GPNET-0 study aims to understand how general practice is implementing decarbonisation actions and to generate actionable recommendations on how to support and accelerate the implementation and sustainability of these actions. In our previous study policy brief, developed in August 2024, we identified GP premises ownership, geographic location, recycling costs, and time constraints as factors that are impeding the implementation of decarbonisation actions, whilst co-benefits and organisational culture are enablers. Now onto a summary of the initial findings. This briefing provides additional findings that emerged during the first 18 months of the study, drawing on data collected from longitudinal work with general practice teams, surveys and interviews with patients and stakeholders, and an economic analysis. A workshop with multidisciplinary practice teams is a feasible and effective way to inform, encourage and support decarbonisation planning, and an evaluation form revealed that workshop participants found a video describing opportunities for decarbonisation in general practice to be useful in facilitating action planning, and many participants were likely to share this with colleagues in their practice. Secondly, a survey of patients identified that concerns around environmental efforts in general practice could compromise the quality and accessibility of their healthcare. Next, we found that patients viewed a lack of information as a barrier to them taking actions that would facilitate the reduction of practice-related emissions. And many patients expressed a desire to understand what practices were doing to combat their carbon footprint. Next, practices in leased buildings were identified to have limited access to cost data for completing an economic analysis of their decarbonisation actions. This was largely due to limitations around access to particular costs, for example, energy bills and waste disposal costs, which hindered the ability to accurately measure cost changes as a result of decarbonisation action implementation. Next, stakeholder participants have suggested that the term decarbonisation does not encompass the entirety of this topic, and that the term itself is uninspiring. It was felt that focusing on carbon did not acknowledge the important ecological impacts of healthcare delivery. Finally, many stakeholders emphasised the importance of framing decarbonisation in general practice as an added benefit in order to increase buy-in from staff, patients, and NHS commissioners and policymakers. An example of this could be using the cost, efficiency, or healthcare benefits in order to frame decarbonisation strategies. Keep an eye out for the study's final policy brief, summarising the whole study's findings and recommendations, to be released in spring of 2026. Thanks for watching this video, summarising the second GPNET-0 study policy brief, detailing key evidence emerging from the study as of April 2025. You can scan the QR code to read the policy brief in full. And to find out more about the study, you can visit our website at www.warwick.ac.uk/GPNET0 or sign up to our bi-monthly newsletter. Please see here a list of study publications as of January 2026.